Hey, I'm Dr. Joe Alaimo. Today I want to talk about autoimmune diseases. We hear this thrown around a lot today in the news, and it really is on the rise. We talk about autoimmunity. There's 140 known, probably more, autoimmune conditions currently. And what autoimmunity means is that the body loses self-tolerance. So it starts recognizing its own tissue as something foreign and it attacks it. We have approximately 20% of the population suffering with autoimmune disease. That means 1 out of every 5, and 75% of those are women. So women really need to be aware of some of these conditions. What are some names of the more common conditions that we see? Rheumatoid arthritis, when you have the genes, bad genes for joints. We have Hashimotos, thyroid, Graves' disease, thyroid. We have celiac disease when autoimmunity affects the gut. We have multiple sclerosis when it affects the brain. So all this means is that we're giving it a name for the target tissue that's being affected. But the bottom line is the problem is really with the immune system and not necessarily with that tissue. Again, that means loss of self-tolerance. The body starts recognizing parts of its own body that are foreign and tries to attack it in an attempt to defend the body and protect the body. We have a three-legged stool when we're talking about immunity that has to be present. The three things that we see commonly or that need to be present to actually get an autoimmune condition, one is you have to have the genetic predisposition. That means that somewhere along the line, the genes were handed down to you. Now, you can't get it by drinking out of the same cup as somebody or anything like that. You have to be born with these genes. Then we have certain things that turn those genes on and off. We call them triggers. And triggers are vast. And what we need to do is identify as many triggers as possible and then try to correct those. The last thing that needs to be present in order for an autoimmune condition to present itself is a leaky gut. I know your doctor doesn't believe in leaky gut, but trust me, do the research. It's out there. Leaky gut is when large particles of food leak through the intestinal wall. We call that intestinal permeability. It gets into the bloodstream. The body attacks it because it's foreign. It's not supposed to be there. And then we develop multiple food sensitivities. So in an attempt to try to help correct some of these conditions, in the next videos, we'll go over each one of these three-legged particles here, the genetics, the triggers, and the leaky gut. We'll go over each one of those in a separate video. But for now, just understand that these three things need to be present. So if you do have an autoimmune condition, we know you have the genes, we know you had a trigger that turned it on, and we know you have a leaky gut. So I hope that helps a little bit clear up some of the confusion. And the next videos, we'll go over each one of those. Thanks and have a great day.